on today's tips for physical therapists from prosthetists. Transfemoral prostheses. Don't teach your patient to walk backwards unless you know for sure that that prosthetic knee is going to work for you. Why am I talking about this today? Well, the reality is many, if not most, prosthetic knees will not behave the right way when you're walking backwards. Most modern prosthetic knees have some type of safety and security built in them. And many of these rely on where the prosthesis is in space and traveling, or some type of known trigger to transition from where the knee is safe and going to support if there's a misstep to where it's just free motion and ready to swing for their walking. Now, because all of these sort of rely on seeing normal gait, if you start walking backwards, where you start with the leg in full extension and going backwards, those two things can be two different triggers depending on the knee. And then you try to put weight on that leg, that knee's just going right out from under him. That stance safety is not working. And we know that teaching a patient to walk backwards is one of those normal goals that you have in physical therapy for somebody with two legs or even for somebody with a transtibial prosthesis. So you have to know that it may not be safe with your transfemoral patients, and you have to coordinate with your prosthetist to ensure that they may have a knee that is safe for doing that, or that they have a knee that's off your plate on things that you can teach and train. So please look out for these patients. Be aware that you could be putting your patients in danger if you're teaching them how to walk backwards and you don't know this. And I'd love to hear your comments down below. So, surprise to you? Oh, I hope not. But if it is, or if you've had a bad experience, would love for you to share it so that we can be making sure the word gets out there to not walk your patients backwards unless you've checked with your prosthetist and know for sure it's a knee that will walk backwards for your patient. Thanks a lot. Wish you well.